Hi everyone, my name is Sarah Brighton-Hall and I'm here to talk to you today about blood pressure. Today we're going to discuss a little bit of the normal function of the circulatory system, and then we'll move on to issues with blood pressure such as hypotension and hypertension. And finally we'll talk about the treatment of these conditions. Okay, let's get started. Blood pressure is measured as the ratio of the systolic pressure over the diastolic pressure. The systolic pressure is the pressure in the arteries when the heart beats, i.e. when the muscles of the heart contract, while the diastolic pressure is the pressure in between heartbeats, i.e. when the muscles of the heart are relaxed. And for reference, normal blood pressure is generally between 90 and 120 over between 60 and 80. Hypertension is a condition of abnormally high blood pressure. It is generally anything over 140 over 90. Anything in between this and the normal of 120 over 80 is classified as pre-high blood pressure. Hypertension can be caused by emotionally or physically stressful situations, unhealthy diet, lack of exercise, obesity, etc. Blood pressure also generally rises naturally with age. Have it for years and not realize their increased risk of health problems, as hypertension is largely a symptomless condition. Although in a hypertensive crisis, an individual may experience severe headaches, anxiety, shortness of breath, and nosebleeds. Hypertension leads to an increase of chance of heart attacks and strokes, which adds to the danger of it going undiagnosed. Hypotension is the condition of abnormally low blood pressure. It is generally anything under 90 over 60. It can be caused by heart problems, certain medications, endocrine problems such as thyroid conditions, low blood sugar, as well as some cases of diabetes. It can also be caused by lack of nutrients in diet, or even just a genetic disposition to have low blood pressure with no other health problems. It is also associated with severe allergic reactions and septicemia, or severe infection. Low blood pressure is not as much of a serious medical issue as high blood pressure, as while hypertension can lead to long-lasting permanent damage, even as extreme as heart attacks or even death. Regular day-to-day symptoms of hypotension are much more mild. They include dizziness, lightheadedness, fainting, nausea, fatigue, and cold, clammy, pale skin. Overall, issues with hypertension are much more common, as well as more serious in the general population. Now, hypotension has very little treatment other than staying hydrated, keeping blood sugar at preferable levels, and rest. Hypertension, though, as the generally more pressing medical issue, has a wide variety of treatments. Usual treatments for hypertension include lifestyle changes such as healthy eating, regular physical activity, a reduction in the intake of alcohol, and maintaining a healthy weight, as well as medications. Medications include diuretics, which decrease sodium and water uptake in the kidney, thereby lowering their levels in the blood and reducing blood pressure. There's also beta blockers, which help the heartbeat slower and with less force by slowing the pace of SA node, which initiates the heartbeat. You can see its label here at the top left of this diagram. And vasodilators, which relax the muscles in blood vessel walls, which can lower blood pressure as well. As stress is often a trigger for individuals with hypertension, it is also recommended they find their own ways to manage and cope with stress, such as exercise, yoga, meditation, or even listening to music. As reported in the Science Daily article from 2013, a new method for treating hypertension is being developed, whereby the carotid body, a small cluster of chemoreceptors and support cells found on each side of the carotid artery in the neck, is removed. It is located at the fork where the carotid artery branches off to the internal carotid artery and the external carotid artery. Normally, the carotid body would be stimulated by a drop in oxygen in the blood to increase breathing and blood pressure until oxygen levels are restored to preferable. Without this body, there wouldn't be that extra stimulation to increase blood pressure, which can be a permanent treatment and a huge relief to people suffering from hypertension. I would just like to say a huge thank you to the National Heart, Lung and Blood Institute, the American Heart Association, Mayo Clinic, as well as cardiachealth.org for the use of the diagrams and pictures from their websites. I'd also like to say thank you to Science Daily for their article. Thank you all for listening, and I hope you learned something about hypertension and hypertension.